Hi, welcome back. So, in this lecture, we are going to cover problems in adolescence. Most teenagers go through adolescence without big problems, but about 1 in 5 face serious issues that can affect their health and their growth. And so, we're going to cover some of the common challenges, which include depression, suicide, eating disorders, alcohol and substance use, and delinquency. So, adolescence is a critical developmental period that's marked by significant physical, emotional, and psychological changes. And so, overview of adolescent problems are mental health challenges. So, we're going to go over depression and suicidal thoughts. They are a common severe mental health issue that's faced by adolescents. There's eating disorders like anorexia, bulimia, and binge eating, which affect adolescent physical and psychological health. Alcohol and drug use among teenagers can lead to serious health and social problems. And lastly, delinquent behaviors. So some adolescents get engaged in delinquency that requires intervention and support to redirect behavior. Depression is a common mental health problem for teens. About 13% of 12 to 17-year-olds in the US meet the criteria for depression. It's characterized by persistent feelings of sadness, hopelessness, and frustration, changes in sleep and eating habits, difficulty concentrating, and a loss of interest in previously enjoyed activities. The onset of depressive symptoms typically increases during early to middle adolescence. There are some notable gender differences that emerge. So we often see that girls report depression at twice the rate of boys. They may also sleep or eat differently. There are several factors that can contribute to depression. So genetics can affect how the brain handles emotions. If there's stress at home, money problems, or children are living in unsafe neighborhoods, it can impact them negatively and make depression worse. Family relationships matter, so having supportive parents can help ease depression, but if a parent is depressed, it can add to a teen's depression and struggles. Cultural factors like differences between parents and children in immigrant families can also cause stress and depression. So understanding depression means looking at all of these factors together rather than each of them individually. Severe and long-lasting depression can lead to thoughts of suicide, which means trying to end one's life. Suicide is one of the top 3 causes of death for people ages 10 to 24 in the US and many other countries like Canada, the UK, and Australia. The US teen suicide rate has increased by over a third between 2007 and 2017. So about 17% of high school students have reported they have thought about suicide in the past year. Girls are more likely than boys to report these thoughts. Around 7% of teens have attempted suicide, and 1/3 of these attempts need medical attention. Boys are more likely to die from suicide than girls, and this is partly because they often use more lethal methods. LGBT youth, especially male and bisexual teens, are at a higher risk, with 3 to 4 times more suicide attempts than other teens. For transgender teens, the statistics are 1/3 to 1/2, and they have reported attempting suicide. Family conflict, peer rejection, and struggles with sexual identity often contribute to these attempts. So there is an urgent need for inclusive mental health support to address the unique adolescent suicide risk factors. So we'll talk about 2 eating disorders that you might have heard of: anorexia nervosa and bulimia nervosa. And both of them involve an extreme concern with body weight and a strong desire to lose weight, but they show up in different ways. People with anorexia nervosa often starve themselves and sometimes exercise excessively because they want to be thinner. So even if they are dangerously underweight, they might still look in the mirror and believe that they're overweight. This happens because of a distorted body image. And distorted body image is the perception of their body not matching reality. About 2% of girls under 19 are affected, and many more can show similar behaviors without being officially diagnosed. Girls who participate in activities that emphasize a thin or lean figure, like ballet, gymnastics, figure skating, or long distance running, are at a higher risk for anorexia nervosa. Bulimia nervosa, on the other hand, involves binge eating, which means eating a very large amount of food in a short amount of time while feeling out of control. It's often followed by purging, which means trying to get rid of the food through vomiting, excessive exercise, or using laxatives. People with bulimia are usually unhappy with their body shape or weight, but unlike anorexia, their body weight often stays in the normal range or slightly above normal range. Bulimia is more common than anorexia, and it affects around 1 to 5% of girls and women. Both disorders are very serious and they can have dangerous health effects. So anorexia nervosa can cause bone loss, kidney and heart problems, brain damage. So these can be fatal, and it actually has the highest death rate of any mental disorder. Bulimia can lead to vitamin and mineral deficiencies, mouth and throat sores, and damage to the esophagus because they're repeatedly vomiting. These disorders are found in people from all backgrounds. So they're found across different ethnicities, income levels, and cultures. Studies show that in the US, white and Latina girls, especially from higher income families, tend to be at higher risk. African American girls may be somewhat protected by cultural values that celebrate curvier body types, but researchers also warn that eating disorders may go undiagnosed in African American girls due to barriers in access to care. In addition, LGBTQ plus youth are at higher risk for unhealthy weight control behaviors like fasting, purging, or taking diet pills. Recovery for these eating disorders is possible, but it can be very challenging. So many teens with eating disorders still have symptoms even 5 years after being diagnosed. Anorexia in particular can be hard to treat because people with the disorder often don't recognize that they're ill, and only about half fully recover. So anorexia and bulimia are often linked to worries about body image and weight, but they do differ in how those worries show up. And so both need understanding, support, and professional help to overcome them. So now we'll cover binge eating disorder, which involves uncontrolled episodes of eating large amounts of food without purging behavior. So it's actually the most common eating disorder, and it affects up to 5% of adolescents. It is often more studied in girls, but about 1 to 2% of boys may also experience binge eating disorder. It occurs across all ethnic groups and often starts in early adolescence or early adulthood, and it can last for years if it's not treated. Binge eating means eating a very large amount of food in a short period of time. People often say things like, I totally binged on pizza, but binge eating disorder is much more serious than just eating a lot at once. People often binge in private, and afterwards they may feel guilty, shame, or disgust about what happened. Oftentimes they feel like they can't stop, so it's not necessarily enjoyable. It usually feels very uncomfortable and upsetting. And unlike bulimia, binge eating, it doesn't involve purging. So it doesn't involve trying to make up for overeating through vomiting or excessive exercise. Doctors diagnose binge eating disorder when episodes like these happen at least once a week for 3 months. Like other eating disorders, binge eating is linked to unrealistic body ideals. body dissatisfaction, and negative emotions. People who feel sad, anxious, or stressed might turn to food for comfort, especially high-calorie comfort foods that can temporarily improve their mood. Over time, binge eating can lead to health problems like obesity, diabetes, stomach pain, and other conditions that are related to weight. It's also associated with anxiety, depression, and suicidal thoughts. Treatment for binge eating disorder focuses on helping people develop healthier eating habits, improve body image, and manage their emotions. And this can involve therapy, behavioral training, and sometimes medication to support recovery. Experimenting with alcohol, tobacco, and marijuana is common among adolescents. By the time most US adolescents finish high school, about 2/3 of them have tried alcohol and nearly half have tried an illegal drug at least once. For many adolescents, trying alcohol, marijuana, and tobacco can even be seen as normal, and experimenting with these substances often increases during the teenage years and into early adulthood. Surprisingly, there is some research that shows a small amount of experimentation doesn't always mean trouble. It can sometimes be part of normal adolescent development. Trying alcohol or other substances may feel like a way for teens to assert their independence, fit in with friends, or learn about themselves. However, there is a big difference between trying something once and using it regularly or developing a pattern of use. Even though substance use is common, it still poses a serious risk. Teens' brains and bodies react differently to alcohol than adults do. So, for example, teens may not feel the same warning signs that adults do, like feeling sleepy, uncoordinated, or sick. So they might drink more without realizing how much they've had. This can increase the risk of alcohol dependence, and it can also lead to academic problems, risky sexual behavior, aggression, anxiety, and even suicidal thoughts. Alcohol can also harm the developing brain. So even moderate drinking in adolescence is linked to smaller brain size and less gray matter in areas that control decision making and self-control. It especially affects the frontal cortex. The good news is that if teens stop drinking, the brain can recover some function over time, but scientists are not sure how complete this recovery can be. Marijuana can also affect the brain. So regular use is tied to problems with attention, learning, memory, and processing speed. Like alcohol, it can cause brain changes, especially when use begins before age 18. And it can even more so affect adolescent development before age 16. Some recovery is possible after quitting, but again, it's unclear how much. Most adults with substance use disorders say they started using before age 18 and they develop their problems by age 20. And this shows how important it is to delay substance use for as long as possible. So certain factors make adolescents more vulnerable to substance use. Adolescents are less at risk when their parents are warm, supportive, and involved with their life, especially if parents know where their teens are and who they spend time with. On the other hand, family stress, poverty, mental health problems, trauma, or exposure to drug use at home or in the community all increase risk. Peers also play a major role. So adolescents are more likely to use alcohol and drugs if they think their friends are doing it or they believe their peers are approving of it. Prevention programs that help teens understand real norms can help reduce the use. Several factors can influence adolescent likelihood of engaging in substance use. Some protective factors are parental involvement, warmth, support, and awareness of children's activities and friend groups. So teens are less likely to develop problems with alcohol or drugs when their parents are involved. They're caring and aware of where they are and who they spend time with. Risk factors, on the other hand, include having a low socioeconomic status, family history of mental illness or substance abuse, living in a disadvantaged neighborhood, and being exposed to trauma. All of these are risk factors. So For example, if the family is in poverty, or children are under a lot of family stress, or there's a lot of conflict at home, or there is drug use in the home or community, it can greatly increase their chance for substance use. Teens that have experienced trauma or they struggle with mental health issues are also at higher risk. Peers also play a very huge role. So teens are more likely to use alcohol or drugs if their friends use them, if they believe their friends approve of using them, or if they can easily access substances. So because peer influence is so powerful, effective prevention programs can teach teens the real facts about peer behavior. They can teach them that most teens don't actually use substances and that their peers are less accepting of drug and alcohol use than they might think. And so, because peer norms can heavily influence adolescent behavior, there are a lot of prevention programs that can teach adolescents skillful resistance to peer pressure. So during adolescent years, teens naturally like to experiment and they like to try new things, test the limits, and explore their independence and gain autonomy. And for some, this experimentation can include delinquent behavior. Almost all teens do something considered delinquent at least once, but most never get caught or come into contact with the police. In 2018, teens under 18 made up about 7% of all arrests in the United States. And this includes 10% of violent crimes, 11% of property crimes, and 5% of drug violations. Boys are about 4 times more likely to be arrested than girls. The good news is that juvenile arrests have dropped sharply over the last 40 years. So we do still see racial and ethnic differences. Black youth are more likely to be arrested than white youth, and Asian American youth are the least likely to be arrested. Latinx and Hispanic youth have arrest rates similar to white youth, but they are more likely to be referred to court for minor charges. These differences may partly reflect greater police presence in lower income communities and fewer community resources available to youth of color. Most delinquent behavior doesn't last into adulthood. Many teens may show an increase in rule breaking during early and middle adolescence, but this usually declines by late adolescence because adolescents are maturing, improving their thinking skills. They're better able to exhibit more emotional control as they get older. They also are more likely to exhibit empathy and moral reasoning. And so we see a lot of these behaviors declining as people get into late adolescence, early adulthood. There are several factors that can cause an increased risk for delinquent behavior. So, for example, individual traits like excitement or sensation seeking, or person craving excitement is more likely to commit more delinquent behavior. Family dynamics, peer influences, and parenting styles can all impact adolescent delinquent behavior. And so delinquency is more common among those that have little parental supervision or they're inconsistent with their parenting. They spend lots of unsupervised time with peers, especially those that break the rules, and they're easily influenced by peers. When parents are inconsistent or harsh or overly controlling, it can increase a teen's impulsive behavior. Mild delinquency is fairly common. It's not always a serious problem, but a small number of teens do commit serious violent crimes. These adolescents are more likely to keep offending into adulthood. And teens who end up in serious trouble often show behavioral problems starting in childhood and may have had early contact with the justice system, sometimes by age 12 or younger. So it is important to take preventative measures in order to reduce the risk of delinquency and promote positive growth in adolescence. Measures would be supportive parenting, more consistent parenting, not overly controlling or harsh parenting, so giving adolescents more autonomy while also instilling discipline and rules that they can follow. Having more parental involvement can also reduce the risk of delinquency as well and promote a positive behavior. And then also being able to have more supervised time, making sure that parents know who their kids' friends are, making sure there's less unsupervised time, and just being more involved in terms of parenting. This could really make a difference in terms of reducing the chances for delinquency. Also, having more structured activities scheduled and helping adolescents improve social skills. This can really also reduce their risk for delinquent behavior. Adolescence can be a challenging time, and many factors affect teens' health and development. So, the main summary and key takeaways here is that adolescents face challenges. And there's a lot of influencing factors. There's genetic, environmental, cultural, and social factors that influence adolescent health and behavior. And so these problems don't just have one cause, they're shaped by a mixture of these different factors and influences. Having supportive family relationships, realistic views about peer behavior, and access to helpful resources can protect teens from many of these risks. It's important to identify problems early on and provide intervention and support when needed. Parents, teachers, and healthcare professionals should work together to create environments that promote resilience, safety, and well-being. So by understanding what leads to these challenges and using targeted prevention strategies, we can help teens navigate this critical stage of life in a healthier and more positive way.